Meeting called to order.
Thank you. I request President Rotarian PHF Ritika Gupta to confirm the minutes of the previous meeting.
The minutes of the previous meeting were shared on our Rotary group for everyone's reference, and I thereby assume everyone has gone through them. Thereby, the minutes of the previous meeting stand confirmed.
Thank you so much. And today, our topic of today's meeting, good evening and hello everybody. The today topic is prenatal care for healthy organs of mother and baby. And today can we see the screen? Okay, so today our guest is Dr. Surangana Agrawal, Senior Gynaecologist, Saraswati Hospital, Mathura. I take the pleasure of introducing our guest today. Dr. Surangana Agrawal is a Senior Gynaecologist at Saraswati Hospital, Mathura. She completed her MBBS from MGM Medical College, Indore, followed by her DGO from Government Medical College, Nagpur, and her DNB from Escorts Fortis Hospital, Faridabad. A distinguished figure in her field, Dr. Agrawal holds the rare honor of being featured on the cover page of Femina India, oldest and one of its most widely read women's lifestyle magazine, a distinction achieved by only a select few doctors across the country. So welcome Dr. Surangana Agarwalji for taking out your valuable time with us and being here with us and at our club, Rotary Club of Organ Donation International. Over to you, Dr. Surangana.
Thank you, ma'am, Ruby Agrawal, ma'am. Thank you, Lal Goyal, sir, for making me a part of this beautiful topic, prenatal care for healthy organs of the mother and the baby. Good evening, respected members of the Rotarian Club of Organ Donation International and everyone else listening to me today. As a gynecologist, I have seen many pregnant females coming to me every year. Some of them have a lot of apprehensions. Some of them come with hope. Some of them come with a lot of excitement. But one thing what is common between them is everyone is asking from the God one thing, that God, please let our baby be healthy at the end. So just here comes a role of prenatal care, which is extremely important for every mother or every pregnant female, which has to be attended during the antenatal period. So I would like to say that baby's care or baby's health journey does not begin when the baby is born. It begins in the womb itself. So the womb is the first place, first school, first nutrition center, first protection center, and perhaps the first ICU for the babies. And it is how strange it is that it is just like a miracle. From a small tiny cell, there's formation of the entire baby. We can see the brain containing multiple neurons. We have heart beating every second. We have kidneys containing a lot of nephrons working day and night, helping passage of the dirt from our body. And besides this, there are certain other things like the eyesight being developed, hearing system being developed, and also the immune system, which is silently being developed within the baby. So what shapes all this? It is not any science or not any medical technology or any medicines. It is the antenatal health or the care the female receives during the pregnancy period, the emotional support they receive during this period, or the environment what is provided to them during this period. So the prenatal care is not a luxury, it is a necessity. Today also, I have seen females coming to me confiding their antenatal checkups just to the ultrasound findings or just to the blood reports. But I want to bring about the importance of this prenatal care today so that we can tell them it is not only you who are living. Now you have two persons to take care of, one tiny heart beating within the other. So we all know that whenever the mother suffers from any complications, it is ultimately the baby who is going to be the sufferer. and ultimately it may have long-term complications on the baby. So if the mother is anemic, we all know there's decreased blood supply to the baby, and the baby may be nutritional deficient and also be growth retarded. If the mother is hypertensive or she has preeclampsia in medical terms, so we know sometimes we may lose the baby in such cases. If she is diabetic, it may lead to long-term complications of obesity, hypertension, and diabetes in the baby in the long run. So if the mother is stressed, malnutrited, or treated poorly in the environment, if she is smoking, she is having alcohol, or she's developed certain infection, ultimately the baby is the one who is getting affected. So every healthy habit during pregnancy is actually a gift to the baby's health for the future. So some of the patients that come to me, they ask me, what can we do? I tell them that the first knowledge or first thing that you give to your baby is not education or not a property or not money. It is the health, which begins within the womb itself. But in today's life, since the families have converted to a nuclear families and the joint families are no more there, there's no one to take care of the pregnant females. Moreover, the females are adapting to a different lifestyle. They want to conceive in the later in their life. There is a lot of pollution, there is a lot of exposure of infections, and there's a lot of exposure of addictions like alcohol and tobacco, and this ultimately affects the health of the baby. Earlier, the grandmothers or the grandparents used to take care of the babies. They used to ensure that the pregnant female in their family is eating healthy, is having a happy environment, is provided with the emotional support, so that the ultimate outcome turns out to be a healthy family. So I would like to discuss few certain things which is related to medicine take in prenatal care. I would like to start with the third slide regarding the prenatal care. Can you please share it? Fourth slide, physiological changes. So there are certain changes in the pregnancies. These are for the people who are expecting, or the knowledge can be imparted to the females in your families or the pregnant ladies in your families, so that they are aware about the natural things, what happens in the pregnancy and what all can be done for them. So there are certain physiological changes which naturally happens with everyone in the pregnancy. So regarding the different systems of our body, in the cardiovascular system, there is increased blood flow, which leads to increased cardiac output. This is basically to provide increased blood supply to the baby so that the adequate amount of nutrition is reached to the baby. For the respiratory system, there's increased oxygen demand. So in the renal, there is increased glomerular filtration rate, so that she can cope up with the pregnancy changes that happens during the antenatal period. And also there's hormonal adaptation and physiological anemia and hypercoagulable state. Next. So when the mother comes to us, there are certain things which is regularly monitored for her. The first of all is the blood pressure. So we need to monitor the blood pressure at every visit, so that we can identify the hypertensive disorders early, or we can also identify the low blood pressure, which is basically normal during the mid-trimester of the pregnancy. We encourage them with certain activities, moderate physical activities that can be pursued by them. And we also, if the female has high blood pressure, we can give them dietary advice about the salt and fat restriction that could be done. And we can, so that we can identify any other symptoms that can be harmful for the mother early. Next. In the maternal respiratory health, if we we ask the mother to be away from smoking or the passive smoke exposure. Certain vaccines are being provided during the pregnancy. As per WHO, two tetanus vaccine should be provided to the females during the pregnancy. Now we have introduced diphtheria and acellular pertussis component in that, and we now no longer give the plain tetanus, which was earlier being provided by the government setup. Still, tetanus is being given by the ASHA workers, but in the private setup, we have adopted to the new rules, and we give a combination of diphtheria, acellular pertussis, and tetanus. Along with it, we give the influenza vaccine so that the female is prevented for certain respiratory infections. And Sorry. Next. We ask the mother to drink adequate amount of water, that is 12 to 14 liters of water, 14-liter glasses of liquids. We screen her for the urinary tract infection so that there's early detection, and ultimately there's subclinical urinary tract infection in the pregnancy, which ultimately may lead to anemia and growth retardation in the baby. So regular urinary tract infection checkups are necessary during the pregnancy, and we should also take care as a healthcare provider that we are not prescribing certain drugs which are which are nephrotoxic and can affect the health of the baby. In case of the liver health, we take care that the liver is basically the source of protein formation. So we ask the mother to take a high protein diet and avoid alcohol and hepatotoxic drugs. We also screen for gestational diabetes, which is common in the females during pregnancy. Besides this, we see for the thyroid function because it may lead to abortions and or preterm delivery in the later trimesters of the pregnancy. We encourage for healthy weight gain, which is prescribed to be 11 kgs. That is the 3 kgs in the first trimester, 3 kgs in the mid trimester, and the 4 kgs in the last trimester. Also, we ask her for the lifestyle modifications. If she's more on the junk food, we ask her to shift herself to a more healthy and balanced diet. We give certain supplementations to the females during the first trimester. We ask them for the folate and omega-3 fatty acid supplementations, which are basically necessary for the neural development of the baby. After the first trimester, we advise them with the calcium and vitamin D supplementation, which is basically necessary not only for the mother to maintain her posture and to combat her back pain and osteoporosis, but also for the formation of the fetal muscles and skeletal health. We also ask them to take adequate amount of proteins through diet. These are all the dietary things which we encourage them, but besides these come the most important, which is the mental health. Today in the society still there is a lot of myth regarding the prenatal care, antenatal care. There's still mothers coming to me that their mother-in-law have asked them not to visit to the hospital during the first 3 months, and that should be avoided. But I want to draw your attention that antenatal care is very important. In the first 3 months, as soon as the mother identifies that she's pregnant, she has to visit the doctor so that the other unnecessary complications that may arise of ectopic pregnancies or the neural tube defects in the baby that can be combated timely. We provide them emotional support and ask them to be free from stress. We screen them for anxiety and depression, ask them to take a proper sleep so that the circadian rhythm is maintained. And if there is any domestic violence or any disturbance in their house, we try to talk to their parents or to their family so that they live in a healthy environment, and mental wellness ultimately leads to improved fetal outcomes. So this I have already discussed that the nutrition during pregnancy is very important. Besides the supplementation provided by us as a healthcare providers, we ask them to increase their calorie and protein requirement as per the baby. We ask them to increase their diet containing certain amounts of irons, folic acid, calcium by encouraging fruit and vegetable intake, increased amount of water intake, and we ask them to avoid junk food and excessive caffeine, and ask them to drink a lot of water, 12 to 14 liters of liquids. Neural tube defects, we have seen baby coming with anencephaly, spina bifida. These are certain most common neural defects which we see in the babies, and ultimately mother has to lose the baby at the third month of the pregnancy or at the 5th month if diagnosed late. So in that case, we ask them to start with folic acid supplementation before conception, 3 months prior to conception, and should be continued 3 months after conception, that is in the first trimester, and daily supplementation of the folic acid is advised. Basically, it is important to prevent certain neural and brain development abnormalities. As I have already discussed, anemia is the most common cause common problem in the Indian females still, despite being so much awareness about the iron supplementation. So we can prevent this iron deficiency anemia, which is common, by providing them proper iron supplementations, and also reducing the risk of preterm birth, and by monitoring hemoglobin periodically during different trimesters, we can advise them the necessary treatment what is needed for them according to their hemoglobin levels. Calcium supplementation is essential for fetal bone mineralization as well as to prevent maternal bone depletion and to support muscle and the nerve functions. And indirectly, they also help in preventing hypertensive disorders. So proper supplementation is necessary for every mother. So during the first trimester, basically there is the formation of the brain and the heart, lungs, and the limbs. So it is very important for the pregnant female to not go to the medical store and take medicines randomly for cough, cold, loose motions, or other illness. They should every time visit their gynecologist so that proper medications which are teratogenic can be avoided, or the things which are medically safe or the medicines which are medically safe can be prescribed to them. We ask them to be, we also make them aware that you should be away from the X-ray and CT scan exposures so that the development of the baby is not affected. There's again one myth that the females are still in a feeling of that ki we cannot do an ultrasound daily, but I want to draw your attention that ultrasound is basically the sound waves which are generated because of the vibrations of the piezoelectric crystal, and it is not harmful to the baby. You can do a scan daily 24/7, and it is only the X-ray radiations and the CT scans which are to be avoided for the pregnant females. So again, adequate folate and omega-3 fatty acids, they need to be taken for fetal brain development. Maternal stress also affects neural development, and thus we have to take care of the maternal well-being as well. Fetal heart forms early. At 5 weeks, we can see the heartbeat in a baby. That is the first thing which we inform the patients, and they're very happy. But we have to take care that proper maternal oxygenation is essential for a proper heart formation. Other other problems like maternal diabetes or hypertension, if the mother is having prior to pregnancy, they should be attended during the pregnancies. Even the thyroid supplementation, if they're taking any before the pregnancy, has to be taken proper care during the antenatal period so that dose can be adjusted, modulated, and proper dose is given to the pregnant females. So lung matures progressively throughout the pregnancy. It is at the end, that is after 34 weeks, when the lung attains their maturity. So most of the time when we deliver a premature babies, we have seen that it is the lungs, basically they are put on CPAP or they put on ventilators. It is because the lungs are not matured, but most of the organs are formed. So we can just save the baby through the proper supplementations. So maternal smoking can impair lung growth. We can prevent preterm births to reduce respiratory morbidity. So maternal infections, if any, should be treated regularly. Up till 2 to 3 months, there are certain hormones which are working for the survival of the baby. But after 3 months, the placenta is the sole organ and the ultimate supplier of the oxygen and nutrients to the baby. So any other complications of developing in the baby is ultimately going to affect the placental health and the growth and the Doppler studies of the fetus. So healthy placenta ultimately ensures healthy organs. Again, coming that screening for various problems like HIV, hepatitis, syphilis, and rubella is common during the pregnancy, so that the affected baby is not born. We have seen in the syphilis, if the mother is affected and if she is affected during the organogenesis period. The baby may be deaf, the baby may be blind, and the baby may develop heart problems. So the screening for all these diseases is necessary during pregnancy. The female should be vaccinated with rubella prior to conception so that she does not develop rubella during pregnancy and suffer. Ultimately, the baby is going to be the sufferer. And with the rubella, we have one thing that the baby when it is born, the baby may seem normal, but ultimately the baby may be deaf or the baby may be blind. And also, whenever possible, when we are aware of certain diseases, we should prevent vertical transmission by choosing the proper mode of delivery, ultimately providing a healthy organs to the baby. Avoid alcohol, tobacco, unnecessary use of the drugs, medications, radiation exposure should be avoided. Patients should avoid screen time for the healthy growth and mental growth of the mother as well as the baby. I have seen a lot of mother, because they're working, they have excessive screen time, and which ultimately affects the health of the mother and the baby. That should be avoided. Next. So there are certain routine antenatal investigations which everyone must be aware about. What we do in the pregnancy, just a quick brief. We do a routine hemoglobin check, we do a sugar check, we do a thyroid check, blood grouping, which is very important, because if the blood group is negative for the mother and the father turns out to be positive, then there's certain complications which can happen in the baby. There's hydrops fetalis, and ultimately there is a difficulty in consecutive pregnancies, and the mother may lose the baby every time. Our serial ultrasounds at necessary time should be done. There should be no fear regarding the ultrasounds. Basically, there are 5 ultrasounds which are advised during the antenatal period. The first one is done for the diagnosis and the location of the pregnancy, which is done during around 8 weeks. Then we have the nuchal translucency and nasal bone scan, which is done at the 12 weeks or the 13 weeks. Then we have the anomaly scan or the TIFA scan, which is a detailed anatomy scan, which is done at the 25 weeks of the pregnancy. And later we do the growth scan, because ultimately the baby is born and we need to monitor the growth, which is done at the 28 weeks, and the Doppler studies at 34 weeks. These are the basic 5 scans which should be done. Rest, if needed, multiple scans can be done for the mother. So ultimately, lifestyle is the key for the healthy pregnancy. Mother, besides having adequate sleep, stress reduction, safe physical activity, they should have a regular antenatal visits, so that ultimately it can lead to a healthy organ of the mother as well as the baby. Besides, they should also have the family and the social support. So pregnancy is not a weakness, it is basically a creation, and every creator, that is the mother, requires respect, emotional support, protection, and dignity. So because a peaceful and emotionally secure mother ultimately contributes the healthy development of the baby. There are certain warning signs which should be immediately looked after during the antenatal period. If the mothers have reduced fetal movement, or they have bleeding or the leaking PV, if there is high grade fever, breathlessness, or severe abdominal pain, they should urgently seek medical advice. Now comes the role of the healthcare provider, that we should provide evidence-based prenatal counseling, ensure respectful maternity care, early detection of the complications, promote vaccinations and nutrition, and coordinate multidisciplinary care when needed. So also I would like to say that when the mother is the healthy, ultimately the future generations are healthy, and it is ultimately the society who is going to get benefited from it. So we should take care, we should see that mother is not malnourished, she is not stressed, she is not neglected or medically ignored. We should take care of the pregnant females as a responsibility of our own. It is not just the mother who is going to bear all this. It should be the family who should talk to her, sit beside her, or just understand the problems she is suffering through. It is also family responsibility and ultimately a national responsibility, because motherhood automatically builds a healthier future. And besides this, also I want to say that in the organ donation, one person comes to life after donating the organs when the person is already dead. And in this antenatal period, we are diagnosing diseases much before, because they are evident in a baby, and take measures to prevent them. So basically, I have also seen there are a lot of miracles in the in our hospitals. I have seen premature babies which are likely, we are expecting the baby to die, and we see the baby survives and grows year by year. I have also seen families celebrating difficult pregnancies. So medicine is just not a science, it's a hope, and hope grows stronger when the society becomes aware. I want to tell the young couples that when you are planning a pregnancy, you should not be only financially independent. You should also be physically, mentally, emotionally independent to take care of the newborn baby. And uh, the family should be by the side of the pregnant female. It is not her journey alone. It is the caring family which itself becomes the powerful medicines. I have seen females coming to me, I'm giving them medicines, and that is not helping them, that is not healing them. And just few words of sympathy or empathy, I'm talking to them, understanding their problem, and they feel fine in the next few moments. So basically discussing things with the mother or providing them proper antenatal care is very important, and we should of it. Above all this, we should see that healthy societies only form when the mother or the birth giver is herself feels secured, herself feels respected, herself feels valued. So team-based care should be ensured to the mother, and ultimately it ensures a safer pregnancy. Early interventions and educations are the key. Everyone should be aware of the complications and the signs and symptoms and should discuss with the caregiver. And comprehensive antenatal care improves the long-term outcome. Ultimately, the long diseases that the baby is likely to develop, like obesity, hypertension, that can be prevented through these prenatal or antenatal care. And thus, it is essential for healthy maternal and fetal organ development. Thank you.
Thank you. Thank you very much, Dr. Surangana Agrawal, for giving in details about the antenatal care of mother and baby, which is very much required today, because what we are doing in Rotary Club of Organ Donation International, we are advocating about the organ donation. But the main thing, the basic thing is, if the organs are not healthy, that's why the organs are required. But if we will control, if we will see to it that at the time of prenatal or antenatal care taken properly by a proper gynecologist or proper family care, then definitely the organs, if they will be healthy, then they will not require the organs what we are seeing today, that so many people are suffering from the organ failures, because one of the reason is that their care was not taken properly. And you have elaborated very carefully and clearly about this. And I'm sure that all the listener, viewers, our members who are watching today's program will be benefited, because after all, they might be their daughter-in-law or the granddaughters, they are going to deliver soon. So they must know that how to take care, no stress, etc., etc. Thank you very much. And I must congratulate you for appearing on the Femina's front page. Although in one of the program you have mentioned that it happens, but it is really, it's not a very common feature that Femina takes at least a female doctor, a gynecologist on the front page. So congratulations for that. And now, before I will open for the questions one can ask, my only one question to you is, in case if you diagnose at the time of prenatal that somebody is going to suffer about the kidney problem or liver problem, any problem, can we cure at that stage before the delivery?
Usually the kidney problems, if there is absent bilateral kidneys or bilateral renal agenesis, then the baby is not going to survive when the baby is born. So in that case, we have to terminate the pregnancy. So besides that, any other kidney problems can be tackled after birth. Usually we advise the baby with the USG on the day 5 of the birth, so that the proper diagnosis could be made and proper treatment can be advised to them. Further, we refer them to the pediatricians for further management. Ultimately, kidney as such does not cause anything to the baby. Yes, hepatomegaly in turn may turn up to jaundice and may lead to hydrops fetalis, and that may also be the baby may not survive. In that case also we may need to terminate the pregnancies. So we need, that's why the anomaly scan is very important. We need to clarify the which of the, if the baby is in case suffering from any abnormality, that can be diagnosed on time, and the termination or the continuation of the decision of this can be taken timely.
Okay, thank you very much. Now I'm opening it to the floor. Whosoever wants to ask the question, please unmute yourself and raise your hand so that I can see, and then immediately I will pick up. I can see Rotarian Professor Dr. Sudhir Saran. Yes, Rotarian Professor Dr. Sudhir Saran, please ask your question.
Thank you, Dr. Surangana, for a very brilliant presentation.
Thank you, sir.
I am mainly concerned about the nutrition side of the discussion that we had. We have micronutrients and micronutrients.
Yes, sir.
And we know the recommended daily allowances for micronutrients. Today, the farmers are cultivating more for profit.
Right.
And we are not getting the healthy food which expecting mother needs. Do you think there are ways other than supplements which we can adopt, like new techniques of microgreen production or hydroponic production is there? As a doctor, do you think those new techniques hold promise for pregnant women particularly? Should they get their food from these new techniques?
Sorry, I missed your question. New techniques, what new techniques were you talking about?
Microgreens, for example, are very rich in micronutrition. They provide minerals, they provide vitamins, they provide phytonutrients. Microgreens are, 7 to 10 day old sprouts. Then there is hydroponics.
Yes, we prescribe them, but we just advise the females. So whatever you're consuming, that should not be raw. And it should be boiled properly so that the other bacteria or the things which may affect their health with the raw things that are avoided. And we definitely advise them with the sprouts and everything that can be taken by them during the pregnancies.
Thank you.
Thank you very much. Now I can see Rotarian, Inspire President, Rotarian PHF, Ritika Gupta. Yes, please.
Thank you very much for your presentation, Dr. Surangana. It is, I'm sure, very, very helpful for all expecting mothers, and in fact even the families who have members who are expecting. I would just want to ask you a question on how do you think has the health of the expectant mother changed with respect to external factors, while there are so many internal factors that we can take care of at our individual level, or the family can at an individual level, but there are so many other external factors that have changed as well, wherein the nutrition levels of food has gone down, since the purity has gone down, the pollution is even worse. Similarly, all the external factors have contributed, I'm sure, in some way. I would want to understand from you, what is the difference that you notice from the earlier pregnancies versus now?
Basically, I have two categories of the patients, some coming from the village and other coming from the proper working status. The mothers are working. So I have seen that the females coming from the village are much more equipped, like they have a proper diet and nutrition. Besides, they are not taking the supplementations regularly. And even the females coming from the cities, they're taking proper supplementations. They're having regular antenatal visits. Besides that, they're developing a lot of complications at the end of the pregnancy, turning up into a cesarean section, which they don't really want it. So basically, during the in the city's case, I have seen that they have a more sedentary lifestyle. They are not doing any physical activity. So I asked them for a proper physical exercise that are advisable to them, seeing their conditions, if there is no any other medical condition. Besides that, I asked them if they're using laptops or phones, they don't keep it on their lap. Better keep it on their tables so that they're away from the radiations which is being exposed. I asked them not to keep their phones on in their pockets, or don't sleep with the phones on their head, near to the head, so that the radiations are not being continuously transmitted to them and even their baby. Besides this, I asked them to not from the natural sources. Besides supplementation, additional supplementation, I have to give them for the micronutrients like the magnesium supplementations or the omega-3 fatty acids. I have seen the females coming from the cities. They are themselves aware of these complications, and they have a lot of views at the Instagram reels, and I just need to clarify their doubts and ask them to follow the proper thing which is healthy for them.
Okay, thank you very much.
Thank you very much.
I
Dr.
can see Rotarian Uma Jhavar's hand raised. Rotarian Uma Jhavar, are you there? Because you are on, your video is not on. Rotarian Uma Jhavar, can you unmute yourself? Yeah, please unmute yourself.
Good evening to all. Very informative and very nice session, and it's helped me a lot. My daughter-in-law, just now 5th month, she's pregnant, and this information really very useful for me and informative information. Thank you, Dr. Gupta. Yeah.
Dr. Agrawal.
Dr. Agrawal, sorry.
Yeah.
Dr. Agrawal. Her education from Indore now.
Yes, and you are also from Indore.
Yes, sir. Yes, sir.
So
Thank you.
Rotarian Uma Jhavar is running a eye bank in, there's the first eye bank of Indore. It's a MK Bank, International Bank, and that's why she's very happy, and she has not asked any question to you because you have studied in Indore. Anyway, thank you very much, Rotarian Uma Jhavar. Now, because Rotarian Uma Jhavar is connected with eye bank, so my question to you is, Dr. Agrawal, what about eyes? Can we also, a doctor also diagnose the condition of eye? Because eye is a tissue definitely, so of the mother as well as the baby, so that the baby will not suffer during the lifetime, as well as the mother will also not suffer after the delivery.
Basically, for the baby, we cannot diagnose anything regarding to the eyes, because ultimately the eyesight appears little later when the baby is born. So we cannot talk about it. But in the premature babies, if the baby is born prematurely, we can have the retinopathy of prematurity. So we can advise the females, if they're turning up to be a premature delivery, better go for an eyesight checkup to your ophthalmologist. Besides, there are certain diseases, as I discussed, like rubella, syphilis, all these can affect the eyes of the baby. So the proper mode of delivery, proper medications, or timely detections of these diseases is very important, so that ultimately the sufferer is not the baby organ, because it is very disheartening for the mother when the baby is born healthy and she comes to know that her baby is not able to see anything, they cannot feel the word. So it is very disheartening for the mother, for the baby, for the family. So that is why prenatal care comes at the prime importance, and every mother should not ignore it. Now it's 21st century, we should go to the doctors, because we are not living in the earlier times when there were proper food, proper nutrition, there's no radiations, there is no environmental pollution. But it is now the necessity and of the time to go to the doctors and meet them and get proper checkups.
Okay, thank you. I can see President-elect Rotarian Himlata Bhandari. Yes, please.
Yeah, good evening, Dr. Surangana Agrawal. It was a very interesting session, very useful and informative also. I want to just know that during pregnancy, the maternal diet deficient essential nutrients can lead to a phenomenon known as the fetal programming.
Right.
That is also known as the Barker hypothesis, I think so. So which of the following best describes how prenatal care and malnutrition nutrition directly impact the long-term organ health of both the mother and the developing baby. Because some people know they vomit every time. I mean, they don't intake anything. I know so many people continuously for 3 months, even certain people, even for the 9 months also, they'll be vomiting. So in this case, what do you suggest and how they will do that? What
So
intake they
basically-
will take and how for the developing baby, how it will be useful?
Basically,
Just explain.
during the first 3 trimesters, there is excessive vomiting to certain females. It is because basically of the hormone, that is beta HCG hormone, which peaks at around 9 to 10 weeks of the pregnancy. So the vomiting is likely to increase, but it is not necessary that everyone is going to have vomiting or the
No, I
symptoms
know,
of the
but not
pregnancy.
everyone. Some people
Right?
I know.
So yeah, some people, if they have frequent vomitings, my advice to them is always that keep something dry, biscuits or toast near to your bread. When you get up, take an antacid and then you eat this thing. You don't have to keep your stomach empty so that the acid generation is not there. So you have to take small and frequent meals every 2 hours. You have to eat, because if you're not eating and vomiting everything, then there's nothing going inside your body. If you're even eating and vomiting, then at least 1 to 2% or 10% of the food is going to absorb in your body. So it is better keep eating. You may not like the food in the first 3 trimester, but once you start eating it, you like it and you can have it. It is not necessary that you have to take the milk, or you have to have the rotis, or you have to dal or dahi. There's pressure from the mother-in-laws that my daughter is not eating this or not eating that. I've seen people losing weight in the first 3 trimester, but that is not a problem. Basically, the first 3 trimester is for your baby to get established in your uterus and certain organs to be developed. There is no growth of the baby. There is no growth of the mother. If the mother is also losing weight, there is not a problem. Besides it, as a doctor, I provide them with certain antiemetics, which is basically vitamins B6 supplementation, and that take care of our pregnancy vomiting. If that is also not taking care of, I try to find out certain conditions which may also cause excessive vomiting, that is hyperthyroidism. So we take care of the thyroid checkup. Also, besides, if this is also not working, then we work on the other medicines, that is the ondansetron, we advise them to take. Seeing the risk and safety benefit ratio, if the mother is excessively vomiting, then we have to give that medicines. Also in the later pregnancies, if the mother is vomiting, so the doxinate is the key. Doxinate is basically, I'm telling the brand name, basically the vitamin C, B6 is it is the drug which takes care of her vomiting during the entire pregnancy. Basically, it is the nutrition and how she maintains her life or lifestyle during the pregnancy depends how much vomiting is going to she is going to vomit. If she is having equally timely spaced food and proper food, then the chances of vomiting are less. If the patient is not tolerating any iron supplementation or calcium supplementations, then we ask her to take those naturally. And at the end, if she is anemic, we advise her IV irons.
Thank you very much. Okay, I can see one more our member from Indore, Rotarian Ramnath Pradeep. Rotarian Ramnath Pradeep, would you like to say something today or ask any question from a doctor who studied at your Indore? Please unmute. No, we can't hear you. You are on mute, Mr. Ramnath Pradeep. Please unmute yourself. Yes. Yes, go ahead. Mr. Pradeep, you can. I think we can't hear her. No, we can't hear you, Mr. Ramnath Pradeep. I think some problem is there in your. We can't hear you. Anyway, so any other? No, okay. So anyone else wants to ask any question? Or okay, I think today Dr. Surangana Agrawal has given so much in detail the presentation that our members have nothing to ask. Only one thing which again I would like to ask you, many female who are in obesity, as you have mentioned about the obesity, etc. Nowadays, because of the injections which are very much prevailing of the obesity. Are you also suggesting those mothers, expecting mothers, to take those injections or not? And what will be the effect on the baby of those injections?
Basically, we don't advise mother for the injections. Mother, if the mother is overweight, there's certain criterias how much weight gain she can be done during the pregnancy for the mother. As I have already told, the recommended weight gain is 11 kgs for a normal BMI person. If the person is obese, then we ask for just 3-4 kgs of the weight gain that is recommended for the mother. And for that, we have to prepare proper diet chart for her, and we give her the proper diet chart so that there's no weight gain. With that also, she has a proper nutrition for the mother and the baby. The myth of giving ghee in our country for the normal delivery is still prevalent. And every time a mother comes to me, there is a mother-in-law with her, and I have to clear this myth that the ghee is going to to her stomach. It is getting absorbed from her stomach. It is not going to the uterus, and the baby is not going to come slipping out for a normal delivery. So please clear the myths which are prevalent around you all. I think this is a wonderful platform for clearing such few myths which I come across, and everyone can be aware about them.
Okay. Any other myths you want to bust today regarding this?
Yes, first myth is that you don't visit to a doctor prior to 3 months. You have to visit at the 3rd month only. Second visit is you have to take ghee at the end of the pregnancy for the normal delivery. Third myth is that you have to keep your hairs open for the normal delivery, other the babies can stuck and you have to land up in a cesarean section. Fourth myth is if the pregnant female mother should not come until the delivery, otherwise the baby is not going to get delivered normally. There are a lot of myths.
Okay. So according to you, the myths, we should not believe on myths, and that is very correct because, doctor, before you will leave, my last question to you is, you have seen, although you are quite young, so you have not seen the earlier phases, but earlier time, the delivery used to take place in India, especially generally normal deliveries. Then the phase came for the cesarean. Now, what is the phase, whether people are preferring cesarean or are going for a normal delivery?
See, it's 50-50 because the females are much more educated who belongs to the city side, because they are also physically active. A lot of females are going for a walk. A lot of females are going for gym and everything. So there's a lot of social awareness about the physical activity and the diet supplementation. So the ratio has converted to 50-50 because the person who is, and also we have epidural anesthesia, which is a boon to the pregnant females, which is provided when reduces the 80% pain of the pregnant females. So there's more encouragement for the normal deliveries. Ultimately, cesarean at my place is being done for necessary reasons. If there is any fetal distress, or the baby is getting stuck up, or if there is a cephalopelvic disproportion, the baby is not getting into the pelvis, and multiple other reasons which are necessary for the cesarean section. But yes, I have seen people coming from the villages are more likely to develop normally because they have a more flexible pelvis, because they have their more routine day-to-day activities sitting on the ground, like cooking on chulas and doing the gobar lap, or doing the cow work or the buffalo work. So their pelvis is much more flexible and accommodate the baby more easily, and they're likely to develop labor pains on time and deliver a healthy baby.
Okay, the last question. Cesarean versus normal delivery, organs which will be healthier of the baby after the cesarean baby or the normal delivery baby?
As such, there is no difference in the mode of the delivery as far as the organ of the baby is involved. But there's one difference, like when the baby comes through a vaginal delivery, there is a squeezing of the baby when they come out through that pelvis. So the lungs, which are filled with the water during the antenatal period, are squeezed up, and there is expulsion of all amount of fluid which is present in the lungs. While in the cesarean, when the baby is born, there may be some amount of fluid in the lungs, but with time, within 24 hours or few hours, that fluid get absorbed. So I think mode of the delivery does not affect the organs. Yes, if the mother is suffering from active disease like HIV or hepatitis. In that case, we do not promote vaginal delivery because there is more exposure of the baby to the maternal blood and more chances of transmission of the virus to the baby. In that case, we ask her for a cesarean delivery so that it is a quicker procedure and there is less exposure of the mother's blood to the baby.
Thank you very much. That's all from my side. Over to you, Inspired Secretary.
Thank you so much, Dr. Surangana, for very, very detailed insights about the prenatal care. And I request Professor Dr. Sudhir Sharan, Rotarian Professor Dr. Sudhir Sharan, to give the vote of thanks, please.
Thank you, Dr. Surangana, for a very enlightening presentation. We are definitely very impressed that you were on the cover page of Femina. That definitely made us listen to you more carefully. I'm very happy to see the presentation had all the important sides regarding what we lay people need to know. So thank you for keeping the jargons away and speaking to us in a language we could understand comfortably. Most importantly, the issues that you highlighted, as are the myths that we need to bust, surely those are important. And we cannot thank you enough for cautioning us that if we have somebody who is expecting a baby in our family or friend circle, we should pay attention to the points that you have raised. We'll be very glad to have a copy of PowerPoint so that we can circulate to those who will benefit from it. Once again, I thank all our fellow Rotarians who presented themselves today and benefited from the conversation with you have. We hope to have you more often because today you did attempt Hindi में कहते हैं गागर में सागर भरना. You tried your best, but we're hungry. We would like to hear more from you. Thank you for your effort and kindness to us. Thanks a lot.
Thank you, Dr. Sharan, for the vote of thanks. Over to you, President.
Thank you very much, everyone, for attending. Thank you very much, Dr. Surangana, for your very informative presentation. I'm sure it was very, very helpful for everyone. I would now like to adjourn the meeting. So thank you.